The Love Doctor, Episode 013, Sexual Wellness as You Age, Hormone Depletion, Millennial Awareness, and Prevention.
This is Dr. Charles Reynolds, inventor of the O-Shot, and thank you for joining Dr. Emily Porter, the Austin Love Doctor, as she openly discusses your most intimate questions regarding relationships, sex, and personal wellness through the eyes of a medical doctor who treats men and women for a variety of sexual issues using the latest medical advancements available. Get comfortable, relax, and welcome your host, Dr. Emily Porter.
Hi, it's Dr. Emily Porter, the Austin Love Doctor. And today, I guess I wanted to talk a little bit just about the concept of sexual health and sexual wellness as we age, and get it in our heads that we do a lot of things to prevent our body from aging, but we tend to forget about our intimate areas. So we exercise and we eat well, and we go to the gym and we work out to keep our muscles strong, and we take vitamins to keep our bones strong, and we wear sunscreen to prevent ourselves from getting skin cancer and from getting burned and getting getting tan and age damage. But I don't really think that we think about that when it comes to intimate health. So if you think about a comparison to Botox, Botox has been being used cosmetically for 30-ish years. Back when it first started, the average age of women getting Botox was around 50. And now it's more in the 20s. So still only 3% of American adults get Botox. The age has come down quite a bit. So it used to be in the 50s and now it's in the 20s. And so women are thinking about, I don't want to fix a disease. I would rather prevent a disease. So the mindset has sort of shifted. So now we see women getting Botox younger and younger because they know that it's easier to prevent a wrinkle with Botox every 3 to 4 months than it is to try to fix a wrinkle with laser treatment after the fact. And I think part of it is the millennial generation really changed the focus on that. They don't really like to fight disease and try to cure things. They would much rather prevent things from happening. But why don't we do that with sexual health? The whole term vaginal rejuvenation became really hot several years ago. And there were all these desperate or Real Housewives of Los Angeles and all these celebrities that started getting vaginal lasers done and talking about it and opening up the conversation. While I appreciate that they're opening up the conversation, I'm wondering, why are we waiting until we're 50 or 60 or having menopause to try to fix things? You wouldn't do that with your car. You wouldn't wait until the whole engine needs to be replaced and the transmission needs to be replaced. You would go get your oil changed every 5,000 miles, and you would change your tires and you would change air filters every once in a while and try to kind of maintain your car, hoping that you could give it the longest life possible. And that little bit of maintenance, sure, it adds up over time, but it allows you to get a better life out of your car. But we don't do that with our bodies, especially with regard to sexual health. If you think about women having babies, the first time a lot of us really start to even think that there's something wrong is after we have a child. And I remember when I came home from the hospital and I had a 4-week-old baby, and I was in the kitchen and I was holding my daughter, and all of a sudden I felt like I had to urinate. And I said to my husband, I said, take her, take her, take her, take her, take her. And I held out the baby, and he held out his arms. And before I could transfer her from my arms to his, I urinated all over the floor, like a huge puddle all over the floor. And I mean, thankfully it was a tile floor. I could clean it up, but it was super humiliating. And I was thinking, God, is this how it's going to be? Because it hadn't happened up until that time for 4 weeks postpartum. And at least 25% of women who've had a vaginal delivery have stress urinary incontinence. Probably more than that, actually, but that's at least what we know. Not everybody talks about it with their doctor, but there's ways to fix it, and maybe we should be fixing it sooner, right? We've talked about the O-Shot before in these podcasts, and injecting platelet-rich plasma from your blood under the urethra inside the vaginal wall to kind of help stimulate collagen growth and support the urethra, which is the tube that the urine comes out, and it can help a lot with stress urinary incontinence. Maybe we should be doing that in the hospital. Like, why are we sending people home? Why are we not doing that while women are still in the hospital? We can inject platelet-rich plasma into their scar, or the beginning of their scar where they tore. That helps a lot. After I had my hysterectomy and they did a perineum repair, which is the area between the vagina and anus, I had pain. And I had one of my students at one of my classes inject me with platelet-rich plasma in that area where they had put the sutures in. And within a month, the pain completely went away. And we know that lasers work in that area. We do DIVA in that area. So why are we waiting 30 years later until we're fixing what has been hurting? Why are we not doing that sooner, kind of immediately postpartum? Why are we not doing an O shot in the hospital? Let's inject some platelet-rich plasma in your vagina, in the area of the core. Let's inject some up underneath your urethra to prevent you from getting stress urinary incontinence in the first place and start the healing sooner. That would be my thought, is maybe we should do that. Maybe we shouldn't have to be doing vaginal rejuvenation and restoration. Maybe we should be just doing routine the vagina and kind of the penis as we go along and as we age. We know that after about age 25, women's testosterone production starts to decrease. And that's also translates into lack of libido. And I think we don't notice that it's happening because a lot of us in our 20s are on birth control pills. Birth control pills can bind up your testosterone because they increase a hormone called sex hormone binding globulin. And so you don't really realize it's happening. Plus you might have kids in your 20s or 30s. You get busy, if you have a career, you get more active in your career, and you just kind of let sex sort of fall by the wayside, and you just think that's what married people do. And it just sort of slips past us for a lot of us. The baby's sick, that we have babies at home and the babies are taking up a lot of our time, or we're just so exhausted by the time 10 o'clock rolls around that we don't have the energy to have sex. But it's not just because we're busy with our careers and our marriages and our children. It's physiologic. Our testosterone decreases after age 25, and the production doesn't automatically increase. So production of testosterone just stays stagnant. So we need to replace testosterone in order to feel our best and to have more energy, to have more libido. Testosterone actually increases orgasm, or enhances orgasm as well. It's important in that, maintaining muscle strength. And there's lots of things on the body for heart health and brain health that testosterone helps, but we don't even think about it. I don't think the FDA even really has a goal range for what female testosterone should be after a certain age. We're not really taught about it in medical school. We're taught about low T in men, but we never talk about low T in women. And it's a real thing. And replacing testosterone has lots of positive effects for women. So there's something called hyposexual desire disorder, HSDD. And I think I might have mentioned it on another episode, but basically it is a low sex drive. And in order to be classified as having hyposexual desire disorder, you have to be emotionally bothered by the fact that you have no libido, which is kind of interesting. If you have a blood pressure that's 180 over 90, that's high blood pressure, hypertension. Just numerically, you have it whether your blood pressure being that high bothers you or not. If you have a testosterone level that's, say, 150 and you're a man, that's low testosterone, regardless of whether you're bothered by it or not. But for women, they put an emotional component into the diagnosis, which is very interesting. That in order to be diagnosed with hyposexual desire disorder, you actually have to have some emotional distress at the fact that you have no libido and don't want to have sex. And the most recent numbers I can find say that it affects up to a third of women, which is probably accurate. And I think a lot of it is probably due to low testosterone. But there's a drug called Addy. It's Addiyi, I think is how you spell it. It's a dumb name of a drug because it's hard to pronounce and it's hard to spell. It's also the generic is called flibanserin. And it came out a few years ago and was touted as the female Viagra. But Viagra actually enhances blood flow to penises and makes you be able to get more blood in your penis so you have a better erection. And that's not what flibanserin does. Flibanserin increases the frequency with which women want to have sex. But in 1 month, I think the studies show that it increases the number of times that women have sex by about 1 time per month, which is very, very little, if you want my opinion. I wouldn't spend my money on that. I don't know that insurance even paid for it. So it was very expensive. And I can tell you that testosterone in women will increase the number of times that women want to have sex and enhance their sex by way, way more than 1 time per month. But it didn't get an FDA approval the same way that flibanserin did. So that's why it hasn't made it to mainstream media. It's not coming up in your social media, Facebook posts, or you're not reading about it in Cosmopolitan. But those hormonal changes are real, not even getting into estradiol and estrogen depletion with menopause that everybody kind of knows about. But thinking about, rather than waiting until we're 65 years old or the kids are out of the house and now we want to have sex and it's dry and it hurts, about preventing these problems from happening and starting with our postpartum time, getting off birth control if we can, because we know it binds up our testosterone, getting our O shot as soon as possible after we have a baby so that we don't ever let our tissue get bad, replacing estradiol and supporting ourselves through the menopausal period rather than waiting 10 years afterward. So that's kind of, the concept that I want to bring out there is that we should be thinking about sexual health in a preventative way rather than fixing something that's broken. Let's not rejuvenate a vagina. Let's maintain a vagina. And along for men, you have erectile dysfunction. Statistics show it's about 10% per decade of life. So 40% of men in their 40s will have difficulty with erection, 50% of men in their 50s. If you think about that. And again, you wait until it gets bad enough that it becomes problematic. And then men are much more apt, I think, to go to the physician and ask about what they can do. And I think a lot of that was just due to Viagra. Viagra came out, and even though it was expensive, you had men that were like, well, my penis doesn't work as well as I want to. Sure, I'll lay down $100 for a pill of medication and get it, even if it's not covered by insurance. And the ads were all over TV. They were in Men's Health. They were in Playboy. They were in all over TV. I mean, everywhere. You couldn't be on the media for 5 minutes and not hear about Viagra when it first came out. Everyone knew about it. They even knew what color the pill was, right? The little blue diamond pill. Everybody knew that. Name one other medication that you know what color and shape the pill is. It was amazing marketing that they did, and men bought it. And they paid whatever it cost to get it because they didn't want to have problems. I think we value men's sexuality a lot more than we value female sexuality. And I think that that's wrong. I think that we should be thinking about women's sexuality the same way that we think about men. And so now, you have all these medications, Cialis and Viagra and Levitra, and there's another one. I can't think of what it's, Stay something. I can't think of what it is right now. But to treat erectile dysfunction. But then you also want to think about maintenance. And so like shockwave therapy or Gainswave, when you start to get plaques in the arteries, as you age, you get the same atherosclerotic plaques that clog your arteries and can put you at risk for heart disease and for strokes. The same arteries get plugged up with the same kind of crud. And we're all taking cholesterol medication to help prevent that. And we try to eat a low-fat diet, and we try to not eat so much saturated fat and all those things to help reduce that from happening. But it's happening in the penis as well. And the arteries that go down to the penis are much smaller than the ones that go to the heart, the main arteries in the heart anyway. And so by the time you start to have erectile dysfunction that's due to flow issues or blood flow in the arteries being impeded by these plaques, you probably already have some element of heart disease. We think about the heart. When somebody starts to have a little bit of chest pain, we do a stress test. It's a screening test. We do an angiogram sometimes and put dye into the arteries to look and see whether there's any blockages. And we do all these things to try to prevent blockages and then to try to treat them very early on. But maybe we can do shockwave therapy. We know that if the plaques are still soft, that the micro trauma that happens with a Gainswave procedure, for example, actually helps break apart those small plaques and flushes them out, kind of cleans the pipes, so to speak. And then they get just filtered out through your body, and they open up your arteries a little bit more, so more blood flow can happen. So you don't even have to have erectile dysfunction before you can benefit from a shockwave treatment, kind of as an ongoing maintenance. And then if you do get treatments, maintenance is important. So we're going to clean out the kind of arteries and clean out the plaques that are there, help build new blood vessels, because we know that the trauma that happens with those procedures actually causes new blood vessel growth to happen. So over the course of a couple months, you're getting new arteries that are building, that now you have sort of, if you think about it in terms of roads, you had a wreck and you cleared the wreck, and then you did some construction and added a couple lanes. So now your flow is better, and you've got these kind of access roads or side roads that you can use as well, in addition to your original arteries. So your flow is going to be better. So if you think about preventative care there, I have some men that said, hey, I don't have any problems, but I just want to see if this will do anything for me. And I said, well, but if you're not having problems, then I just don't want you to be disappointed. And they'll come in and have one treatment, and I'll get email messages from them saying that, they had a crazy erection for however many hours that night, and woke up with an erection, and had a very hard erection, harder than they've had in a long, long time, and had this amazing sex. And yeah, I want to come back every month and have that done again to just kind of keep things healthy. So I guess to wrap it up, I just want to get back to the notion of taking our sexual health and thinking about it in a preventative way. All these other things that we do to try to treat disease and prevent disease, or prevent our faces from getting wrinkles, prevent sunspots from happening on our face with sunscreen. Let's try to shift the focus in our worlds and in our minds to doing the same thing with regard to our sexuality. Let's try to get rid of the word vaginal rejuvenation and never have anything to rejuvenate, because we're doing upkeep as we go along. With the garden, let's not let the garden get completely overrun with weeds and then say, oh, hey, I'm going to go pull all these weeds, and there's so many weeds now that, hell, I might as well just start over with a new garden and plant some new flowers and have this big thing done. Let's try to take our garden and every day give it a little bit of water, and every day put a little bit of fertilizer in it once a week, and pull the weeds as they pop up, so that we can maintain this beautiful garden for as long as we want to enjoy it. I don't know how that sounds to everybody else, but that's what I'm doing in my life. I recognize my testosterone deficiency at age 36. I've been getting hormone pellets with bioidentical hormones with BioT testosterone. My plan is to continue to do that. I've had my O shots. I've had my Diva vaginal lasers to keep things nice and tight, to keep things lubricated. And I'm just doing that kind of annually with those treatments, and then my hormones every 3 to 4 months. And I'm hoping that menopause is a complete breeze, because I'm already in the mindset of maintaining things, that it'll just happen. And then I'll just stay on my hormones and not really have much change. I certainly have lots of patients in my office who are in their late 50s and 60s who tell me that they're having the best sex of their life. Usually it's couples. It's usually women and men that are on the journey together, that are both valuing sexuality, and they're both kind of trying to keep themselves well for one another. They're empty nesters, and they have time and energy and mental focus to want to make their sex lives better. But I don't think we need to wait until we're in our 50s. I think we need to shift the focus and start thinking about these things in our mid to late 20s, certainly in our 30s, for women as we start to have children. So if you have questions for me, you can email us, go to www.austinlovedoctor.com, and there's a place there to submit a question, and I would love to answer your question in an upcoming podcast. I hope you enjoyed this. I hope it helped somebody. And if you think it might help somebody, go ahead and have them subscribe. Thanks a lot.
Thank you for joining Dr. Emily Porter, the Austin Love Doctor. If you have a question about your relationship or sexuality, please feel free to contact her directly at austinlovedoctor.com.